Welcome to Shine Chats. Thank you so much for taking the time to speak with me today, Dana. Could you start by telling us a little bit about your journey? What led you to choose this path? And what inspired you to start the Sweet Smile Foundation?
Sure. Hi, and thank you for having me. I started my journey about 12 years ago as a hygienist in a private practice. And I decided when I had difficulty taking my mom to her dental appointment, she's disabled, she's a cancer survivor, and she has MS. And I couldn't get her into the office. I had so much difficulty, and it just brought upon a lot of stress. So I said, hey, I can do something about this. I can take my tools, go into her room, and do her cleaning and her preventative care right here in our house. And that's motivated me.
It's so, interesting that you say that, Dana, because I have a similar experience. And, what you do, for your career, providing dental care mobily for people that, can't go to the dental office, it really strikes home to me. Not the same country. My mom is in Japan, but also similarly, her health is deteriorating and she has been on dialysis for a couple of years now, so we had to put her into some assisted care this year. And same thing, she needs to, dental hygiene is really important, right? And she couldn't
Yeah.
really, be as mobile. So one time when I visited her, I walked in while she was getting her dental hygiene care. And the hygienist was so sweet. It wasn't just a teeth cleaning. It was like almost like a full checkup. She, took her pulse and she talked to her and, made her seem like, she really cared about her health. And, when you're in that kind of setting, sometimes it gets lonely. She doesn't
Right.
have family all the time around
100%.
her. So, I could see she really enjoyed that visit, from the hygienist. And so, from my personal experience, what you do is so meaningful, and I really do want to thank you. How do you see, dental hygienists contributing to the overall health beyond just dental care?
I think that we are so gifted with personal skills to talk to people, and it allows us to get to know them and also figure out what oral diseases are connected to their overall health, like heart disease, diabetes, cavities. I mean, there's so much that goes into it. We even talk about diet, and we kind of go over, their food diaries and how we can limit things to help their overall health.
Yeah.
And honestly, just being there with them, like you said, I mean, there's times where I'll spend extra time and I'll like hold a hand or rub a shoulder. My patient yesterday, actually, his wife just passed away, and I've met his wife for the last 2 years. She is sitting with him for all his dental care, and
Yeah.
he has dementia, and maybe he doesn't have all the same connections, remembering, past experiences and current events, but I knew that he could, feel sad. So I spent more time with him. So I think that it really helps. It helps just to spend the time.
Mhm.
And then I deliver care of what I love doing. I've been a hygienist for so long, and I'm able to use those skills in a place where, underserved, there's people that just don't receive care at all. And so
Mhm.
it's just become very important to me for their overall health.
How crucial is it for hygienists and really all healthcare providers to be more aware of the specific needs about a homebound patient? What are some of the unique challenges you face when you care for this population?
So, some of the unique challenges that I faced as a mobile hygienist is really creating awareness. There's home health, and there's nurses, and there's occupational therapists, there's, foot doctors. I mean, there's so many people that go into these places, but the missing point, or the missing provider, is a hygienist, is a dental professional. And in my area alone, there's hundreds of nursing homes. And when I show up and I'm happy, like, hey, I'm willing, I'm here for you. They normally close the door at first because they're not sure if it's real or how long it's been around. So I really hope to create awareness. You know, the baby boomers, they're aging and they're sometimes alone. I mean, oftentimes alone. Most of the time, the relatives are in different states, and so I'm communicating with people in different time zones, and I just believe that someone should be there with them, and we shouldn't forget about their oral health.
Tell us, what were some of that challenges early in your career? And if you could go back, what's one piece of advice that you might give to somebody else that's interested in kind of pursuing this path?
Sure. If I were to go back, I would go in there with so much more confidence that what we're bringing to the table is for them and they need us. And I would tell the new graduate in RDHAP that they need you and there's a lot of people rooting for you. I've been lucky. I've fought for grants and I've received them because people believe in this. And sometimes it's scary to do what's uncomfortable, and a lot of educational programs don't teach us about business, they teach us about clinical hygiene. But there are classes out there that we can take and we can educate ourselves to feel more confident. So when we get in there, we're like, nice to meet you. I'm the founder of Sweet Smile Foundation, or I'm the founder of Mobile Dental Hygiene Group. I own that. That is me. That's my passion, but it's my clinical skill. And also I can make a difference in all your residents. I can improve their health and they'll be here longer. They'll be happy, less pain, less emergency visits. I mean, I just hope that, we can make a bigger impact for all these homebound individuals and people that just can't afford it. And that's where Sweet Smile Foundation comes in. I figured out early on that a lot of individuals have limited incomes and they can't afford the service. So I said, you know what can I do? Well, the people that can afford it, I can use a percentage of that and put it into my nonprofit. And so I've tried to find a way to give more and do it with the gift that I have of dental hygiene because I love doing it. So if I can do it for someone that really needs it,
Mhm.
then I feel better. I don't feel like I'm going to get burned out. I'm working hard, working a lot of hours, but I think I'm on the right path to help a lot of people. So
Mhm. You certainly are. You're a very, um, special person, very inspiring, both with your own business, Mobile Dental, but then your charity work. So
please
thank you
do.
so much for sharing your journey and insight.
Yeah,
Like I said, personally, I've seen the work of mobile hygienists and how they can impact, um, one person, and one person leads to many. So, like we were saying, one step at a time,
yeah,
your work is truly making a difference
thank you.
in lives of so many, your family, young families to the elderly. I can't wait to see where you take the Sweet Smile Foundation next.
Thank you.